Hey guys, Coach Steve here. We got a new section. It's called P10 Partners. And what we're doing is we're talking to local businesses that are an integral part of Power 10 as well as my own personal wellness. So what we're going to start off this week is we have Dr. Deb Cindrich here from Sand Hollow Chiropractic. And Dr. Cindrich is a huge part of my everyday or prep when it comes to getting ready for some of these races that I do. And even more so the post-race, putting me back together after the body gets pretty beat up out there. So I want to get a chance to introduce Dr. Cindrich and let her talk a little bit about Sand Hollow Chiropractic and how they approach things maybe uniquely to some others.
Thanks, Steve.
You're welcome.
So first of all, I just want to say that it's really been an honor to work with you, partner with you. As you know from my history of doing this for a really long time, I've been taking care of very high-level athletes for most of my career in the professional realm, professional tennis players and hockey players and ice skaters. And so part of my passion is helping people who are out there playing sports at a very high level to be able to continue to do their best to do so and to do it with as little possible repercussion as possible. Just really very grateful that we have come together because you've helped me so much in my own health journey to keep myself in shape to be able to continue to do what I do, taking care of you guys. And so I think that, you know, my approach is pretty unique, is that it's a multidisciplinary approach. Like I know a lot of people may have some ideas about chiropractic as being like a, pop and pray, rack 'em, crack 'em method of just, manipulation and throwing things against the wall and seeing what sticks. My husband, Mike, and I, who were in chiropractic practice together with, our approach is very far from that. We use a combination of techniques, everything from muscle work to kinesiology, sacro-occipital technique, magnet therapy, acupressure, myofascial technique, and then most importantly also in the rehab part, we utilize exercise therapy, which is where you have become so important in my journey for my own patients in referring them to P10 to be able to allow the work that I'm doing to hold. So I guess that's really, in a nutshell, how I utilize chiropractic to support athletes, whether it's the weekend athlete, the weekend warrior, or the high-level athlete to continue to perform at their best and then to recover as quickly as possible to continue on their journey.
In a quick story, my background is a physical therapist, and in the worlds of the Hatfields and McCoys, the physical therapist and chiropractor are not supposed to sit at the same table together. And what I have found working with Debbie is it's been a great experience on so many different levels. The first time that we actually worked together is I was training for the New York City Marathon. And in the middle of the training, I thought I had developed really bad Achilles tendonitis and I was going to have to shut down my training. And at that time, he said, come, let me take a look at it. And it ended up being something, and my ankle was misaligned, the knee was misaligned. And I remember walking in there with extreme pain in my left Achilles and walking out of there pain-free and running the next day. And to me, that was a life changer for my own training. As you said, I love that I've done past chiropractors and tried, and like you said, the rack 'em and crack 'em and the stereotypes that are out there that are there in all professions. Mm-hmm. But I love working with you in the sense that I know that you're working what I need that day. Is it an adjustment that I need that day? Is it taping that I need that day? Is it magnet therapy? And it's about getting me back to my best performance, not, okay, I need to see you 3 days a week and we're just going to keep cracking you and moving you. And the fact that you incorporate exercise, and I'm very grateful that you choose Power 10 for your exercise referrals. But the fact that you do that to where you're trying to give longevity to those adjustments, I think speaks volumes for your care for the patients that you work with.
And I actually would love to address that thought about physical therapists and chiropractors not ordinarily sitting at the same table. And that's really a shame because we are so complementary to each other. in terms of and any kind of collaboration that can help to further any kind of athlete on their road is invaluable.
Agree.
And the other thing too is that I don't think a lot of people realize that, but chiropractors have training in physical therapy. So when we graduate from school, part of our schooling is physical therapy. So we need to, even on the boards, we need to know how to proficiently utilize ultrasound, TENS, electric stim, and all the other modalities that are part of physical therapy's tools. So I have that knowledge as well, but oftentimes I will refer to physical therapists who are going to more utilize those things specifically, whereas I utilize other things. So I just think that we can all collaborate together, for the benefit of the patient, and it's really important that all of us practitioners understand that the role we play is important and that everybody does have their role. I also think it's important what you said too. With my work, not only is it important to know what you need that day, but just in the overall, each patient is unique. Some people you don't want to manipulate because they're already hypermobile. Or some people, if they're going to be going out and they're going to be performing at a high physical level in a short period of time, you don't want to overwork the muscle, because an overworked muscle is a relaxed muscle. And sometimes an overworked muscle can create inflammation. So you don't want to put that patient in that state when they're about to go out and perform in a high level. You just want to be able to bypass that and talk to the nervous system so that your own body can adapt to what is needed at that time with minimal input sometimes from a practitioner. I think that's where you and I really work well, where I understand where you are at a particular point and not only what I do, but what I don't do.
Yeah, no, 100%. And I mean, how long have you been practicing chiropractic care?
I hate to give away my age, but I've been practicing for over 40 years.
All right, so you came out of the womb and you were a chiropractor.
Yes.
Okay.
When I was 12.
Okay. Yeah. But something that I think shows how much your care, compassion towards your patients as well as your profession is that, I mean, you are still getting certified or searching for new knowledge, like the magnets that just came out. And I know you did an extensive research and education in the magnets, but
Yes.
a lot of people kind of rest on, this is what I know and I'm good and I can take, and
Yeah.
you haven't, like the craniosacral, like the myofascial, like you just keep getting deeper and deeper in it. When someone who, I mean, you say and you kind of glance over, but I mean, you've worked with professional hockey players, the Islanders, you've worked with professional tennis players at the U.S. Open. I don't want to name them all, but I mean, you've had a very high level athlete that you've worked with, and it's very easy to sit back and rest and be like, I'm good at what I do, and people will just do it. But you continue to grow, which can only benefit me selfishly and your other patients that come to see you.
Well, they say, doctor, heal thyself, patient, heal thyself. So, I'm not immune to my own problems. And as you know, that I was recently diagnosed with having Lyme and a co-infection after years of frustration with things that kept being unresolved and me not understanding what was going on. So not only do I continue to search for things that are going to help my patients, but I've continued to search for things to help myself. And in the process, translate that to my practice. So the magnets were a result of that, because I found this Dr. Garcia in the city, who had was known, through various professions for having great results, putting Lyme and Lyme co-infections into remission using biomagnetism, magnet therapy. So of course, when I hear something, I delve in, and I got myself certified in that. And not only did I use magnets to help myself on my own Lyme journey, but of course now I'm paying it forward with everybody. Magnets not only for Lyme, but for trauma, for recovery, and for many other areas where people suffer or have deficits in their journey. And I'm sure that I will continue, as I'm faced with challenges with each individual patient, and I see that there might be something that I don't know about or I don't know what to do about, I will then go and research and put it out there to that community of, has anybody, ever had this situation, or that, whether it's reaching out to a physical therapist or to you or to even a medical doctor, when need be, to ask about a particular situation. And, what I'm very well versed in the pharmaceutical mode of care. I think it's really important for any doctor, whether it's a doctor of chiropractic or regular, obviously a medical doctor, to have a good understanding of pharmacology, especially when patients come to me. I need to know what they're taking. I need to know if there's any contraindications, if I'm going to recommend any kind of supplements. I need to know if they're on a blood thinner or something for high blood pressure, or for, anything that might be pharmacological, psychopharmacological. And that's also, that is continuingly to emerge. I mean, there are new drugs coming out all the time in the areas of immunotherapy, monoclonal antibody therapy. So, without getting too far ahead of things, making it complicated, it's important to know what's out there in every discipline, to know what I'm dealing with.
And you hit on it there. Like, a part of it is, in success and being good, is knowing what you know, but also knowing what you don't know, so you know when to collaborate and work and extend yourself in that. And I think another, as we've hit on the athletes, the high-level athletes that you've worked with, is also, I've been to your office, like, you have across the scale, age-wise, across the scale, fitness-wise, across the scale, diagnosis-wise, to where you see everything come through those doors.
I do, and I really love working with children. That's really one of my loves, because I think it's really important to empower children to know that their body can heal itself, and if given the right tools, that they don't need to be afraid, and that they can trust that their body knows what to do. I think that the education of that is something that I'm very sensitive to, in terms of, helping children not to be afraid when they feel pain, and then to know that they can do something about it that is not invasive, that can actually feel good, and they can look forward to coming to the office. So I take care of children. I mean, I have had patients bring me their children newborns. I've had several babies that were born with torticollis. And obviously, we say, oh, you go to take a baby to a chiropractor. Well, of course, what we do is very gentle. We don't crack babies' spines. It's really about gentle flow and relaxing, and relaxing the dura, whether it's through gentle pussyfooting of the sacrum. I'm getting a little technical here, or other techniques that are completely non-force. I've had wonderful results releasing torticollis, which is another term for stiff neck, or from babies. So yeah, we take care of children all the way from newborns up until the 90-year-old. And because that, we have non-force techniques in our office, which I'll mention again, my husband, Michael, who is a diplomate in cranial work. He's a craniopath. Now, he also teaches that. That again is working with the vectors in the skull in a non-force way that help to relax the whole spine without doing anything that is forceful in any way. Having those non-force techniques is, of course, very important when you're dealing with old people, or people, the aging population who have osteoporosis, where, any heavy manipulation or adjustments could cause a break. So, I think that I forget why I was mentioning that. Oh, just in terms of having people from all ages, and, not only athletes who, have their body is very fine-tuned, but babies or the aging population who are less fine-tuned, and obviously sometimes at a deficit, whether they are not in shape or overweight. That's the other thing, by the way, as you and I are both very, very clear about how important your nutrition is towards any endeavor, whether it's athletics on a high level, or whether it's just keeping yourself healthy. I've been very instrumental in my practice, taking numerous courses in functional medicine as well as nutrition to be able to guide patients in how to, whether it's lose weight or maximize their nutrition to be, with that's selective to what they're doing. I think, again, that's another way. Complementary health is really important for the whole package in the athlete like you are, or in the average person, or that has specific needs.
So again, thank you so much for joining us here on this episode, I guess, of P10 Partners. And I want to thank Dr. Deb Cindrich of Sand Hollow Chiropractic for being here as our guest. Again, grateful for myself for how you helped me. And then our partnership together, referring patients back and forth to make sure the fitness end is tied in to the medical end that you're working with.
Oh, you're most welcome. And thank you for helping me to be my best and being able to continue to do the practice at the high level that I do, because my fitness is so important to me, and Power 10 and you have been super, super important in that journey for me. So thank you.